Hi everyone, Dr. Nemechek here. I want to talk to you about a little trick I learned about how to stop recurrent strep throat, believe it or not. My focus, just 40 years of practice has been involved thinking about the gut bacteria, inflammation, things like that. From the 90s, we knew we had bacterial overgrowth in our HIV patients, and just all the work I've done on balancing gut bacteria to reduce inflammation in people for a variety of problems. What happens is we know that when you have bacterial overgrowth, it'll alter the bacteria in your mouth. And when I moved from Kansas City to Arizona, I was moonlighting in urgent care. It was a lot of fun. I got to see a lot of interesting things, real life problems. One thing I saw was these families over and over and over again. The kids with strep, sometimes 3 or 4 in a family at a time. The same kids every month or 2 or 3 months, just over and over and over again. Now, when you talk to teachers, they'll tell you you'll have, they may have 30 kids in the class, and it's like these 6 are the ones who get strep throat all the time. Not the others, not the ones right next to them, but these 6, okay? And so it's not a contagious, strep pharyngitis, it's not a contagious type of thing in a fashion that we think of like influenza or COVID, where you're sitting next to somebody with the flu or COVID, those people are probably going to get sick too. But that's not the case with strep. There's like a predisposition for strep. And so what I started doing is there was some interesting work looking at a particular probiotic in Italy, and then with some type of prebiotics in adults with recurrent strep throat, and that they were able to alter the balance, and it looked like it might reduce the incidence of strep throat in these adults. So I tried it in kids, dramatic improvement. Dramatic. So what basically is, now with these kids, I would have the moms just give them a inulin gummy once a day. It's kind of quicker. Even though for autism, I'm not a big fan of it for other reasons. But for this, it works great. These inulin gummies, they're flavorful. The kids take them. It's easy to give them. And then from my standpoint, when you run out, the kids are reminding you, hey, the doctor said you had to give me one of those candies every day. We need more. So they'll kind of urge the parents to keep the supply going. Dramatic reduction in strep in these kids, almost completely. All right, and then we would test it out on these families. It would just stop. They wouldn't get strep anymore. It might be 12 months later. Then here they come back into the urgent care. I'm like, what happened? The mom will say, ran out of inulin, and then boom, they all get strep again. So it's cheap, it's super safe, and if you have one or a couple kids that are getting strep a lot and then having to have antibiotics and missing school and you're missing work and all of those problems, okay, get some inulin gummies. And Philips makes a good brand, Fiber Choice makes a good brand. Those are the 2 I would stick with. And just 1 a day and see if it makes a difference. I bet it does. Hope that's helpful for y'all. Everybody, have a great day. Bye.